Hi guys, welcome to Med-Surg Mentor. Today let's review a common topic from cardiology which is also asked as short notes in the university exams. So let's get started. Today let's talk about pericarditis. Let's see its definition, etiology, pathophysiology, clinical features, diagnosis, management and the nursing care. Before moving on to pericarditis, let's see what is pericardium. Pericardium is a thin, two-layered fluid-filled sac that covers the outer surface of the heart. It provides lubrication for the heart and also shields the heart from infection and malignancy. It also keeps the heart from overexpanding when there is an increase in blood volume. As you can see in the picture, there are two layers for pericardium. They are visceral pericardium and parietal pericardium. Space between these two layers is called pericardial cavity, which contains the pericardial fluid. Definition of pericarditis. Pericarditis is defined as inflammation of pericardium, the sac-like membrane that contains heart. Next is etiology of pericarditis. The common etiological factors leading to pericarditis are trauma, which is direct or indirect, bacterial, viral or fungal infections, autoimmune disorders like rheumatoid arthritis or systemic lupus erythematosus, drugs like procainamide, isoniazid or methyl dopa, vasculitis, heart surgery, uremia, radiation therapy, and idiopathic causes. Now let's see the types of pericarditis. The common types of pericarditis are acute pericarditis, chronic pericarditis, constrictive pericarditis, and recurrent pericarditis. Now let's see each types in detail. First category is called acute pericarditis. Here, it develops suddenly and may last up to several months. This condition usually clears up within 3 months. Second category is called chronic pericarditis. It develops over time and takes longer to treat. The third category is constrictive pericarditis. It's a chronic inflammation of the pericardium. Gradually, it causes scarring, thickening, muscle tightening or contracture. Over time, the pericardium loses its elasticity and becomes rigid. And the fourth category is recurrent pericarditis. It occurs when a person has repeated episodes of pericarditis, which often leads to debilitating health conditions. Now let's see the pathophysiology of pericarditis. Due to the etiological factors, there is pericardial injury. As a result of this, the inflammatory response gets activated. At the next stage, the pericardium is healed, scarred, and thickened. It leads to restriction in the cardiac filling, which in turn leads to increased ventricular pressure. At the next stage, there is increase in the pulmonary artery pressure due to the increased ventricular pressure. As a result, the cardiac output is reduced. At this stage, there is compensatory tachycardia, which tries to maintain the cardiac output temporarily. But gradually, the compensatory mechanism is failed, leading to the permanent reduction in the cardiac output. Finally, it leads to heart failure. Next is clinical features of pericarditis. The prominent clinical feature is pleuritic chest pain. It is often expressed as sharp retrosternal or left precordial pain, which may radiate to the lower portion of scapula on the back. Other clinical features are dyspnea, flu-like symptoms, anxiety, tripod position, friction rub, heart palpitations, reduced organ perfusion, ascites, and leg edema. Now let's see the diagnostic measures of pericarditis. At first, let's see some of the common physical examination findings in patients with pericarditis. They are tachycardia, jugular venous distension, muffled heart sounds, hypotension, and pulsus paradoxus. Pulsus paradoxus means a fall in the systolic blood pressure more than 10 millimeters of mercury during the inspiratory phase. Other common diagnostic measures are chest X-ray, electrocardiogram, echocardiogram, blood test, cardiac MRI, CT scan, and cardiac catheterization. Common complications of pericarditis are cardiac tamponade, recurrent pericarditis, pericardial effusion, and heart failure. Now let's move on to the pharmacological management of pericarditis. One of the commonly used drugs for acute pericarditis is colchicine. It is an anti-inflammatory agent that works by inhibiting tubulin polymerization, thereby interfering with the inflammatory cycle. Other commonly used drugs are analgesics like aspirin and ibuprofen, antibiotics like vancomycin and ceftriaxone, and steroids like prednisone. Next is the surgical management of pericarditis. There are mainly two procedures, and the first one is an invasive procedure which is called pericardiocentesis. And the second one is a surgery which is called pericardiectomy. Let's see each one in detail. Pericardiocentesis. This procedure is also called pericardial tap. It is an invasive procedure done to remove excess fluid from the pericardial sac. It is done using a needle and a small catheter to drain fluid. Common needle insertion sites are 5th or 6th intercostal space close to the sternal margin. The second procedure is called pericardiectomy. It is a surgery done under the general anesthesia. In this procedure, a portion or all of the pericardium is removed. It is also called pericardial stripping. It is commonly used to relieve constrictive pericarditis. The common nursing diagnoses for patients with pericarditis are acute pain, activity intolerance, hyperthermia, ineffective tissue perfusion, risk for arrhythmias, fluid volume excess, and ineffective breathing pattern. Nursing care of patient with pericarditis. Assess vital signs, lung sounds, and oxygen saturation. Encourage sitting, leaning forward position. Administer supplemental oxygen. Teach deep breathing and coughing exercises. Encourage pursed lip breathing. Ensure stress management. And encourage progressive physical activity. So far we have reviewed the disease condition pericarditis. Hope this video was informative. Thanks for watching guys. See you next week with a different interesting topic.